I had an operation in November last year for a brain tumour, and I had a stroke after that.
I came to the hospital when I had a small stroke in October 2013. It started out by me having a third stage heart block, renal shutdown and potassium overload. And I had a slight weight problem. I was 172 kilos.
I had no idea that I had a stroke. It happened while I was asleep.
On my 65th birthday, I presented at emergency with a fall. And once you're 65, I think, and you present at emergency, somebody comes and talks to you about, how often you might have been falling. And I'd been having quite a few falls.
So they did some tests and biopsies and found that I had an osteosarcoma cancer in the femur, which caused the bone to weaken and break, and therefore I had to have my leg amputated.
So I lost everything. I couldn't walk, I couldn't talk, I couldn't see, I couldn't read, I couldn't write.
My first thought when I was told that I'd have to have my leg amputated was, will I ever play sport again?
My right side, my whole right side was nothing.
After the stroke, I could understand what people were saying. I could understand everything everybody was saying, but I couldn't relate it. I couldn't say it.
When the patient comes onto the rehab ward, we first have to build rapport with them, and then we start thinking about the goal-setting process. So obviously each patient wants something a little bit different.
I'm a therapist at Minowara House, so I actually get everybody else to set goals, but I forgot to set my own goals.
Everyone is a person and everyone has dreams and aspirations, and I think sometimes we forget that. We're so focused on the health system and the length of stay and getting people out of hospital. We forget what our part is in changing their life.
That's the first thing they ask is, what's your goal? They help you to set a goal.
That's sort of what our programs are based on. And when we know what exactly the patient wants, then we can develop interventions with the physio, with the occupational therapist, with the speech pathologist, even the doctors, any health professional that can help to contribute for the patient to reach these goals.
Your goals shouldn't look the same for every person.
Often us as therapists or doctors feel that we know what's best for the patient and what they want to get out of rehabilitation, but it's really important to take the time to sit down with them, get to know them and set goals that are tailored to them.
That needs this one to help.
Yeah. Good.
But it's slowly.
We're getting there.
My goal is that I will walk again, and I'm determined that I walk again. Doesn't matter how, but I will walk. And I'll be able to use my hand again.
When I came here, came to physio here after I came out of hospital, and they taught me to walk. I hadn't walked for about 12 years.
I have a wedding in October that I'm a bridesmaid for, and my friend was at the hospital with me. She waited while I had my surgery, but I said to her, I'll walk down the aisle at your wedding. Even if I have a cane, I'll be there.
It's having the big picture for them and then slowly breaking that down to what's achievable for the moment. What can we start working on and how do we build up to the bigger picture?
We set the goals, and then your thoughts and your mind and your spirit actually work towards achieving those goals.
Goal setting is not a to-do list. It's to guide you and the person. It's not about ticking a box. It's very much about guiding therapy.
If you have someone who hasn't got time for you, not because they want it that way, but if there is no time, it's just get on with it, it's not going to work.
Because you might do it at the session, lethargically you do your hair right, and then when you get out of that session, you think, oh.
So it's not about you pushing your goals and your desires on them. It's about the person defining it and you working around that.
I was so upset. For 3 weeks, I couldn't swear, okay? Now, I've got a couple of lovely friends, and after 6 weeks, I rang my girlfriend and I said, f***ing me dead, f*** me, I can swear.
If I didn't have a clear goal in my mind that I want to be better, that I want to walk down the aisle at the wedding, then I don't think that I'll be half as improved as here, because that's what keeps me going during practice especially.
If you don't have goals, it's sort of like you're doing something but you don't know what you're working towards. My quality of life is, extremely good. I feel like I can do pretty much anything that an able-bodied person can do.
Look at this way, without the program, I'd still be lying in a bed.
I'd lost my zest for life, and now I feel I can actually do anything.
And now I'd like to think I'm up to about 70%. That's pretty good, isn't it? In 18 months, I'm pleased with that.
We're not the expert. They are. They know who they are. They know where they want to go. We need to tap into that to make our therapy most effective.